Hello, my name is Ian McCall. I want to tell you a little bit about the Getting Under the Skin meeting that was held under the auspices of the Skin Cancer College Australasia recently on the Gold Coast. This meeting looked at, or was subtitled, Dermatoscopy Meets Dermatopathology. And the whole purpose of the meeting was to look at all of the lesions that we regularly see in skin cancer medicine and relate the dermatoscopic images to the dermatopathology. We were very fortunate in having Dr. Clay Cottrell from the United States, from Dallas in Texas, as our visiting speaker. Clay is a dermatopathologist of international repute, and he added tremendously to the value of this meeting. The interesting thing about this meeting and about these lectures that I'm going to describe shortly is that they were interactive. There were often two presenters for each lecture, with a college fellow presenting the clinical and dermatoscopic features of lesions and Clay looking at the histopathology. And this made for really quite entertaining teaching and quite exhilarating lectures. Let me just describe some of them to you. First of all, I think you should subscribe to the whole series of lectures here. If you're involved in skin cancer medicine, you really need to know all the stuff that's in this weekend meeting. I started the meeting off with a lecture on dermatoscopy reports, I should say, and histopathology reports, just showing the similarities between the two. It's great to be able to look at a histo report and correlate it with what you saw down the dermatoscope. It's even better to be able to look down the dermatoscope, look at an image, and work out in your mind what the histopathology should be like. We started in this initial lecture, just to set the scene, by going over a whole lot of histopathology terms, because you were going to hear a lot about these terms in other lectures. And we also did the same thing for pathologists who were visiting by going through dermatoscopic terms. Now, this lecture lasts about half an hour. It's fairly basic, but if you don't know much about the field, you'll find it quite interesting. This lecture was then followed by one from Clay Cottrell himself. Unfortunately, I introduced most of these lectures, so my face tends to appear on the initial pictures here. Clay looked at skin biopsies because the tissue that you supply to the pathologist allows the pathologist to make an informed diagnosis. So you've got to give him what he needs to make that informed diagnosis. And Clay went over the various techniques, their advantages and disadvantages, and when to use which. He also looked at special stains, he looked at immunofluorescence, and he looked a little bit at inflammatory skin disease as well. So an important point to come out of all of this was pigmented lesions. You want to supply the whole lesion to the pathologist, if at all possible, and especially the base of the lesion, because he needs to see that to be able to make a diagnosis. It's important to look at this lecture simply to get a better understanding of the problems faced by the pathologist, and to know how you can best help them give you the answer that you require. The next lecture was a joint lecture. It was presented by Cliff Rosendahl and Clay Cottrell. Cliff is well known as one of the co-authors of the book Dermatoscopy with Harold Kittler, Alan Cameron, and others. And so he did the clinical and dermatoscopic presentations, and Clay then looked at the histopathology. And they went through all the melanocytic lesions, starting from lentigo simplex all the way through to invasive desmoplastic melanomas. So if you want to know about melanocytic lesions, all the benign, all the malignant ones, then this is an excellent lecture. It lasts about an hour. This little thing on melanocytes, I think we have this as a freebie. One of the attendees commented that really melanocytes seem to take on a whole variety of appearances. And so I spent about 5 minutes just putting together a PowerPoint lecture showing the various faces of melanocytes. They really do look quite different. It's useful just to have a look at it. It gives you a feeling for the spectrum of melanocytes and nevus cells and what they can look like in different types of nevi. I then went on and did a lecture with Clay Cockrell looking at basal and squamous cell carcinomas. We mainly concentrated on BCCs because BCCs are the commonest tumor that you're going to see in skin cancer practice. We went through all the various histological types, and we related those to their clinical appearance and related that to the margins of excision and how you should approach these lesions and what's appropriate treatment and what isn't appropriate treatment, and how important is it if you've got mixed histology in a skin cancer, what percentage of, say, infiltrating BCC is worrying. What about perineural spread? It's a very clinically based lecture, this, although there's a lot of histopathology in it as well. Lasts about an hour. The next lecture was one, joint one between Jeff Keir from Ballina and Clay, looking at benign lesions. There are multiple benign lesions that we see in skin cancer practice. Patients grow all sorts of things in their skin. Now, this lecture covers virtually all of these and looks at annotated dermatoscopy from Jeff, and Clay supplied a lot of the histopathology in this particular lecture and discusses these features. So if you want to know about benign skin lesions, this is the lecture we'd recommend. Again, about an hour. Day one ended up with Cliff Rosendahl giving a really very detailed lecture on dermatoscopic histologic correlations of pigmented lesions. This was the sort of insightful version of the talk that I gave at the very beginning. And Cliff goes into this in great detail. He's an expert in the field. Virtually all the cases that he presented were his own. And this is a 45-minute lecture, but is great value. So I'd certainly recommend you look at this one. So day two began with Clay presenting what I think was one of the highlight lectures of the whole weekend. He entitled it Diagnosis and Treatment of Pigmented Skin Lesions, Reconsideration and Reconciliation. Now, what he essentially did was look at the guidelines on the management of melanoma and the reporting of melanoma from the American Academy of Dermatology. These were changed last year, and various things such as the Clark level was dropped and mitoses were brought in. They also brought in things on sentinel lymph node biopsy, etc. Now, Clay took all of these recommendations apart, and he looked at them very critically and really wondered the basis on which they had been put or recommended. And this is really quite a thought-provoking lecture. And it's well worth your while listening to an expert in the field really present the problems from the point of view of a practicing dermatopathologist and a clinician, because Clay is both a dermatologist and a dermatopathologist. So if you're involved in the management of melanoma, look at this lecture. You'll get a lot out of it. Lasts an hour. The next one was one that I did with Rob Panisi. Rob Panisi is a pathologist on the Gold Coast. We decided to give Clay a bit of a rest. And he and I looked at other important tumors in skin cancer practice. We didn't get through as many as we really wanted to. We had prepared a lot of things on Kaposi's and angiosarcoma and some benign lymphocytic infiltrates. But we did spend time on Merkel cell, atypical fibroxanthoma, some spindle cell tumors, and looked at T and B cell lymphomas. Now, admittedly, the latter aren't all that common, but it's important to have an understanding of them if you're doing skin cancer work. So this lasts about, I think, 45 minutes, and certainly just from the point of view of Merkel and atypical fibroxanthoma, it's worth having a look at. The next section is the GEMS section. The GEMS were in fact scattered throughout the various lectures across the 2 days. And they were presented by college fellows. They were 5 to 10 minutes long, and they looked at a variety of topics. For instance, John Pine presented on cutaneous horns, looking at about 150, and looked at the features that allow you to say that one is likely to have a benign base as against one that's likely to have an SCC in the base. There was another excellent presentation by Graham Siggs here on Merkel cell carcinoma, and virtually everything you'd want to know about Merkel cell was in this 15-minute presentation. Neil Chorley gave a presentation, mainly a management presentation on a poorly differentiated SCC, which is the situation we often face in clinical practice. There were other quite erudite presentations on clear cell acanthoma, on nevoid melanoma, on a pigmented BCC in a dark-skinned individual, a couple of other interesting ones, including the presentation of a dysplastic nevus in the face of the elderly. Now, we don't often make that diagnosis. It's usually a melanoma, and the pathologist just doesn't see enough to be able to call it as such. There was a pigmented nail to chat about as well. They're always difficult, especially this case. And it was interesting to hear Clay's take on it as well. And the last one on a halo nevus that had been diagnosed as a melanoma in a child was also a very interesting and provocative gem. So these, I think, are all going to be lumped together in one group from a presentation point of view here, and they're well worth looking at. The presentation of the GEMS by college fellows added tremendously to the value of this meeting, and we're certainly keen to do this again next year if we can. And day 2 ended up with a bang rather than a whimper. First of all, we had Cliff Rosendahl and Clay looking at difficult melanocytic lesions. Most of these were in fact from Cliff's own practice, so we had excellent clinical and dermatoscopic views and good histology that Clay was able to comment on. So again, if you're in the management of melanoma, if you see difficult cases, particularly, you know, the spitzoid type lesions, spitzoid melanomas, or melanoma in a child, then you'll find this presentation very useful. And day 2 ended up with Jeff Keir. Jeff had presented about, well, he had about 6 gems that he was going to present in the gem section, and I encouraged him just to do them at the end because they were a beautiful spectrum of many of the things that we had discussed during the weekend. And I thought it was a great way of bringing it all together. So we've put Jeff's 6 gems as a separate section here, and it's certainly worth your consideration. Again, we had the benefit of Clay being able to present some of the histopathology there and comment on it. So I think you'll find this a very suitable finale to the weekend meeting. As I said, the feedback from this meeting was excellent. People were very enthused. It gave them a greater understanding of the point of view of the pathologist and the issues that the pathologist faces, and allowed them to, I think, present things to the pathologist in the optimum fashion. And it also allowed pathologists to see the point of view of the clinician, and especially the influence that dermatoscopy has in helping to make the diagnosis of some of these unusual pigmented lesions. I think it's this combination of both dermatoscopy and histopathology, having a knowledge of both and synthesizing both together, that really allows us to avoid underdiagnosing and sometimes overdiagnosing certain pigmented lesions. So if you're into skin cancer work, and especially melanocytic lesions, I think you'll find this meeting of great value. Individual lectures I've spoken about, but I'd strongly advise you to purchase access to the whole series, because you'll be able to come back to them time and again, and this is the great advantage of having recordings like this. Once you've purchased this, you can go back to it, and they'll be there for the next couple of years, and I'm sure the situations will arise where you'll say, I remember Cliff Rosendahl and Clay talked about that. I'll go and have a look again at that particular lecture. So I hope you've enjoyed this little overview of what happened at this meeting. We hope to run it again next year, and if you're interested, by all means come along, and we'll probably have a different international speaker just for variety, but we'll have the same format because it was very successful. Thank you very much.